starting the intermediate stage of rehab. The subject is going to do unweighted rows, so bring your arms up. She's going to make sure to keep her scapula tight and bring it toward the spine. And she's going to do 3 sets of 10. Okay. The second exercise is weighted active range of motion. So she's lying on the table with the support in the front, and gravity pressing down on the back. She's going to come up toward me and back down and out to the side and back down, and she's going to reach back. And she's going to do this 2 sets of 10. Okay, the second exercise is weighted active range of motion. So she's lying on the table with the support in the front, and gravity pressing down on the back. She's going to come up toward me and back down and out to the side and back down, and she's going to reach back. And she's going to do this 2 sets of 10. The third exercise is flexion and extension of the wrist with resistance. So she's going to make sure the table is supporting her elbow, and she's going to bring her wrist in an upward motion for wrist flexion. And then she's going to flip her arm around, and she's going to bring her wrist upward for wrist extension.
How many sets?
And we're going to do 3 sets of 10. The next exercise is internal-external rotation. So the subject's going to be lying on the treatment table with the support of the table behind her humerus, and she's going to bring her hand toward me and back up. So this is external rotation and internal rotation. Keep going. And she's going to do 3 sets of 10. The fifth exercise is weighted pronation and supination. So she's going to hold the weight in her hand, and she's going to rotate her hand inward and back outward. So pronation and supination. She's going to do this for 2 sets of 10. This exercise is shoulder shrugs. So she's going to elevate her shoulders and depress her shoulders up and down. We're going to watch her scapula for protraction and retraction. Her scapula should be slightly involved with this exercise, and she's going to do this 3 sets of 15. Next exercise is triceps extension. So we're going to use a TheraBand that's tied to a doorknob and have the patient with her arm extended next to her hip. And she's going to flex her arm, her shoulder backward, and the resistance is going to be with her pulling backward. We're going to do this 3 sets of 10. Exercise are seated dips. So the patient's going to sit in a chair in front of a treatment table and rest her hands on the table and slowly push up without putting too much pressure on her shoulders. Engaging the shoulders, but not putting too much pressure on them. And if it's painful, the subject should stop. We're going to do this 3 times 10.
Go.
The 9th exercise is weighted ABCs. So the patient's going to draw the alphabet while holding a light weight. A, B, C. And depending on the progression, the letters can either be big or small. To start off, we're going to do big letters, but as the exercise becomes easier for the patient, we're going to start making smaller letters to work on control. And she's going to draw the alphabet twice. The exercise of the intermediate stage is bicep curls. So the patient's going to sit on a treatment table with her back flat against the wall and making sure that the back of her arm is flat against the wall, and she's going to curl up and down. And depending on the patient, the weight can be higher or lower. 3 sets of 10.